the caregivers do their best to go in with an iPad with the patients, and they'll meet with them over the iPad to Skype. But it's a hard conversation. It's a hard thing to see over an iPad, to see your loved one like that when you just really want to be with them. And I know that that's a really heavy piece on the caregivers here too. The team holding that iPad, listening to those conversations, typically those are private conversations that happen amongst loved ones. And, we've become a part of that, and having to experience that at that level is just really difficult. And, when there is visitation, that means the odds aren't in your favor. When you're able to actually come in and say goodbye, and when we have to get you ready for that point, that's the scary, harsh reality of this virus is, we don't ever want anybody to get to that point, but we have to deal with that. And the caregiver team deals with that every day here. It's more uncommon to not take somebody to ICU or to have them do poorly than it is that we have a couple people, 2 to 3 every day that aren't doing well on our medical unit here.
So how do you personally and the other doctors and nurses, how do you deal with this?
I think we lean on each other a lot. I know we do, because it's a really amazing supportive team here. Emotionally support each other and carry each other through this. I just know that the team here is amazing and provides amazing care. But there's only so many of us to give that care. You can always get more equipment, build more space, put more beds, but there's not just hundreds of thousands of nurses and doctors and respiratory therapists just waiting in the wings. That we've been trained for years medically to care for patients at high acuity levels that they have right now with this virus, and you can't replicate that. You can't just snap your fingers and make more caregivers appear. There's always space, there's always equipment, but you need us, and we need the help of the people to help fight this so that we can be there for you and continue to give the care that we're giving.
Well, thank you for what you do, and thank everybody else that you work with for what they do and across the state. I can't imagine the emotional toll that it takes on you. I mean, you're seeing people, you're used to treating people who are sick, but this is, I think, would seem to be very different experience. And how do you deal? You've seen some of the things that are posted on the internet, or what people are interviewed who don't think that this COVID is serious. They don't think they should wear a mask. You have anything to say to them today?
I just want people to take it seriously, that this isn't a hoax. It's not blown out of proportion. This is our reality. And me and my team here, we live it every day coming to work. And the team here gets up every day coming in to take care of these patients. And they've been doing it since March. And while it's been coming in waves, this is one of the biggest waves we've ever seen. And we don't see an end to the growth. And we're hoping that we can come together as a state and a country to help slow this. We need to slow it like we did before. And unfortunately, we can't do that without the help of everybody. Masking, doing social distancing, hand sanitizing, all of the things that you're supposed to do.
Well, again, thank you. Thank you so very, very much. And thank you for taking time out of your busy day to, really talk to the people of Ohio. And we just are very grateful for what you do.
Thank you for having me, Governor.
Thank you. We now want to give some insight on what it's like right now inside Ohio's long-term care facilities, our nursing homes, congregate settings. Carrie Watkins is the Assistant Director of Nursing at Jenna Cross Lutheran Services in Holland, Ohio, near Toledo. Thank you for joining us. We appreciate it very much.
Thank you.
Tell us a little bit about what you're seeing every day in regard to the COVID. Again, not something that before March you were seeing, and it certainly has got to be a different thing to deal with. If you could just give us maybe some insight into what goes on and what you're seeing.
Well, we've been seeing recently a huge surge in the cases prior to this. We've been dealing with the pandemic since March. Our facility had gone through several months of being COVID-free. We did have an outbreak back in the end of August. We got through that, but we're seeing now that we're having such a higher rise of cases in the community that it's getting to the point where it's getting into all of these other nursing care facilities and taking over. No matter how much preparation you make, no matter how many things we do to do the proper infection control. We had great surveys. We've had great response of our infection control in our facilities, but it still manages to get its way in. Proper use of PPE, staff education, sanitation, all the things you do right, it doesn't make the virus go away. We've had very sad situations of losing patients, residents in our facility. For example, I remember one of my nurses came back from maternity leave and she had been off for 2 months. She wasn't there during the outbreak that we had. She came back and her hall that she normally took care of 22 residents for years.
I think we got a little problem. We've got her frozen on my screen. And Eric, what do you think? We'll come back? Okay, we'll come back to Carrie Watkins in just a moment, we hope. Let me kind of move on here. Now we're still, let me go now. Dara Pence is an ICU nurse manager at Ohio's Health's Riverside Hospital in Columbus. Her unit has cared for COVID patients since mid-March. Dara, are you on there? Hey, thank you for joining us. We appreciate it very, very much. What are you seeing there as far as your COVID patients and, you know, what impact this is having on the hospital?
Yeah. First, thank you for having me. So we've been here since March on our unit. We were the primary COVID cohort unit for critical care. And obviously our world, as much as many others in the hospital system, were rocked with this. Our team came together amazingly well, collaborated, came up with protocols, policies, guidelines to try to work together on this and battling COVID. We have started with obviously it hitting us, then we've worked with battling stigmas of COVID, going back to business, and now we're back again with this surge. COVID is unpredictable. It's throwing curveballs. Much like Stacy said, you know, we're seeing young, healthy people come and they are sick and they are passing. And then we see, you know, people who check all the boxes of these comorbidities and they're being able to roll out. So it's completely unpredictable. And we just, you know, we still don't know what the long-term effects are for our patients.
So you really can't, when someone comes in, what you're saying is it's almost like you're playing sort of Russian roulette or something. I mean, it's just, you don't really know. Maybe somebody you think may do well doesn't, and vice versa. Is that what you see? Yeah,
correct. Yeah. It definitely does not hold any biases, and it can affect all patients from all backgrounds. Definitely.
Tell us a little bit about, you know, the fact that this is just different, that patients are dying alone, that patients can't see their loved ones, and how that impacts you, your nurses, and how that impacts, you know, the patients who are there.
Oh yeah, definitely. So prior to CDC came out with new guidelines approximately a month or two ago, to where we were able to take down our isolation. And prior to that, we were seeing our patients sometimes in isolation 30 plus days. They would be in there 30, 40 days alone. In our ICUs and in some of our med surge units, we have the different machines that we are using to be able to have negative airflow. And this is really helpful to be able to have, be able to do different kind of breathing treatments, have them intubated, have them on BiPAP, CPAP, high flow oxygen. And these are just all different kinds of ways that we're trying to help treat these patients. But it's still lonely in there. They're still isolated. We're trying to cluster our care to take care of these patients, but also take care of ourselves and our teams. We do use Zoom, much like what Stacy said with using Skype. We are using Zoom, but it's very scary because a lot of times this is the last connection that these family members have with their loved ones, or the loved ones have with their family members. These patients, we are able to have them come and visit, have visitors, but it's at the time we're doing goals of care. We're having those hard conversations with the families. And a lot of times too, on the other extreme, families don't want to come in. They're too afraid. They're too afraid to come into the hospital. They're too afraid to be exposed to COVID. And so again, having that disconnect with using Zoom instead of that personal one-on-one contact, that's what our nurses are to these patients. And they're also that lifeline to the family members. When the family members aren't there, we're making those phone calls, as well as our other healthcare teams. Our doctors are also calling the families to give them updates and have those conversations. A lot of times the families just don't understand the severity of these feelings, of what's going on. And we're seeing a lot of, when we have these conversations with our patients, because we do get to know them obviously very well, the ones who aren't intubated. And, we ask them, what was going on? Where do you think you got COVID? What was, where were you at? What were you doing? And we've heard graduation parties, baby showers, funerals, weddings. And, several of them have said, I had a mask, but I put it in my pocket when I saw that everyone else didn't have a mask. And we have a thing at Ohio Health now that we're saying our president, Steve Markovich, is really pushing to have COVID courage for our staff and our teams, and to wear those masks and show that we are supportive of, what is going on in our system and in our communities, and trying to educate out there to the community to have that COVID courage and wear those masks.
Well, you and nurses across the state who are helping COVID patients, helping them fight for their life, you're seeing things that the rest of us just don't see. And so, what message would you have for, people who might be watching this today in regard to, what you would like them to do to help you and to help the other nurses who are making a difference?
Yeah. I think the big thing for us is, we have our PPE. We are so blessed here to have the PPE, to have all the things that we were scared of not having, we now have. And now our biggest fear is preparing for even more of what we're already seeing. How do we feel when we were asked, how do we feel about when we see the community? And honestly, it breaks my heart. If you think about this, we hear the tornado sirens. Now, mind you, we are in Ohio, so we do open the door to actually see if there's a tornado before we, prepare. But with tornadoes, with hurricanes, when you hear those alarms go off, you pack up, you get all your supplies you need, and you take care of yourself and your family, and you get to shelter and you get to safety to make sure that you can honestly live another day. And that is, I think, the biggest thing now for us. Run out there and go get your toilet paper, go get your masks, go get whatever you need. I would rather see us, honestly, run out of toilet paper and run out of dishwasher soap than see us run out of ICU beds and out of hospital beds and lose more loved ones. I wish that we could bring people here with us and have them walk through our unit. But then I don't wish anybody to ever see what we have seen, what our nurses are going through. Our team is amazing. Our team is strong, but everybody is only so strong for so long. I have a friend who is in the military, and we've talked quite a bit about this, what we've seen. And, he compares it to basically being a battle. The things that we are seeing, we are at war. We are at war with this disease. and we're going to have PTSD. We're going to be struggling with this. And if the community can come together and wear a mask, socially distance, stay at home, stay safe, and that's what's going to help get us through in the long run, then, I mean, that's all we can ask for. Because we here at the hospital are no longer the front lines. We're our last line of defense. The front line now is the community.
Wow. Well, thank you very, very much. Thank you for giving us that insight, taking us inside and kind of through your eyes, seeing what you see every day. Thank you so very, very much. Please pass it on to your whole team. We're very grateful for what you do.
Thank you.
Thanks a lot. I think we'll go now to Jamie Gear as a nurse and team leader for the COVID unit at Premier Health's Upper Valley Medical Center in Troy, which is north of Dayton. She's led a team there for 4 years. On average, there are 9 nurses she supervises each day. And in the last 3 weeks, the increase in patients they've seen has been just huge. These patients are sicker than patients were in the spring and summer. Thank you very much for joining us. We appreciate it very, very much. And what, you told us that you're seeing patients who are just more sick. I mean, what do you mean by that? And maybe just kind of tell us what you are seeing right now.
Yeah, so back in March, again, I'm probably echoing a lot of what other people are saying or the other nurses were saying, but so back in March, we were seeing 5, 10, 12 patients, but now it's evolved into so much more. As one of the other nurses had spoken of before, the patients would come in, on that 2 liters of oxygen, and so very quickly they would require 8 liters, 12 liters, 30 liters, and then onto that BiPAP and CPAP, and then ultimately on the ventilator. And it happens in such a short amount of time, it's hard for us to react. So I feel like comparing our patients now compared to back in March, they are sicker. It's not they don't necessarily have the comorbidities. We're seeing healthy individuals come in and they decline so quickly. And not only I feel like back in March it was more the elderly population. Now I feel like the COVID population has been getting younger and younger.
What would you like to tell people who in Miami Valley or people across the state? I mean, you're seeing this every day. We've heard from several other nurses, but what are you seeing that might surprise people or may not really understand or have a full appreciation for as you deal with this every single day and try to help people, try to save their lives?
I tell my husband this a lot. Like I wish that I could wear a GoPro for just 4 hours of my day for people to realize the stress that us nurses and the PCTs and our respiratory therapists go through every day. It's exhausting. It's emotional. It's emotionally heartbreaking for the patients. We have an excellent team, so we really carry each other, throughout our days. And I don't think the public truly understands what we go through every day, the heartbreak and the emotion and seeing the fear on these patients' faces. This is no joke. This is very serious. And I just want the public to realize that, it's not a hoax. This is real. This is true. And as working in the hospital, we're exhausted. So please, I want everyone to realize that just please take this seriously.
What's the hardest thing for you and for the other professionals who are dealing with this every single day?
The pain and hurt that I see in my patients' eyes. When they're COVID positive, they're not allowed to have visitors in the hospital. They can't have their loved one hold their hand. every, and be by their side and in their time of need. And you can see the fear on our patients' faces. That's heartbreaking. That's heart-wrenching. So as a nurse, I'm not only a nurse, I'm not only a caregiver, but I'm a friend and I'm a companion, and I try to be in the place of as a loved one. I'm not, but I do my best, and I work with a bunch of excellent nurses and a great team, and everybody really works well together, and everybody really helps each other out. Um, and that even goes as far as crying on each other's shoulders and just being there during this stressful situation.
Well, thank you very, very much. Thank you is not very adequate for any of you, but thank you so very, very much for all of us for what you do. And thank you for giving us kind of an insight into what you see that the average person just, certainly does not see, but you see every single day. So thanks for everything that you do. We're very grateful. Thank you. I want to go back to Carrie Watkins, nurse at Jenna Cross Nursing Home in the Toledo area. Thank you for joining us again. Thanks for your patience. And
No problem.
I'm not really sure where we left off, but what else do you want to tell people of Ohio in regard to what you see as far as your patients and what you worry about every day? I mean, I would just maybe before you answer that, I would just kind of summarize, I think, something you said earlier, and that basically is that no matter how good you are, no matter how hard you try, if there's significant spread in the community, it is darn hard to keep it out of your nursing home. So there's a relationship between the spread in the community and what you see in your nursing home.
It's directly related. We have seen such an increase in the surge of the cases in the area. Like I said, it is getting into the nursing homes. I'm hearing stories of other nursing homes that are going through very, very difficult times. The staff are overworked, spread very, very thin. We also have, turned into an extended family for our residents. Their families aren't there daily to see them and spend time with them. And the people that they are used to sharing their daily lives with are no longer able to come in to see them any longer. So not only are we being caregivers, we're becoming the extended family to those residents while their real family can't be there. I was telling a story earlier, I know it had cut out, about my nurse that came back from the maternity leave, losing out of 22 of the residents that she called her family. She cared for them for years. Almost nearly half of them had passed away. And they didn't get discharged home. They didn't go to another room. They were gone. And the pain and the emotion that I saw in her face coming back to that, when not being there during that time, was devastating. We, as nurses and caregivers, work so hard to take care of our residents and just support one another. And people really need to realize that their actions have unintended consequences. Even if you don't have a loved one that's in a nursing home facility, you can start a chain reaction that brings it right into our buildings. The residents we care for are someone's husband, somebody's grandparent, someone's brother, could possibly be somebody's child. And these lives are worth protecting. So we really need to take the recommendations seriously. It's crucial to stop spreading the virus if we all work together and unite as one to just get this. The vaccine is coming, so hopefully we can look forward to a day where we can reunite their families with their loved ones.
Well, thank you very, very much. I mean, I would think that because of the long-term nature, many people who you are dealing with who have COVID, you've known for a long time, and your team has known for a long time. And I'm sure they become almost like family with that relationship. And for the last 8 months, the visitation has been basically cut off. And so, that's the only family, the only connection, direct connection, that they have. So it must be particularly hard on you, as well as on them.
Mhm. We've also became the support for the family members because we are their line of communication. We're not only caring for them, we're also caring for the residents' families that are at home, just being supportive and trying to make it through all of this together.
Well, thank you. Thank you very much. And I want to thank everybody who's working in our congregate care settings, our nursing homes, our assisted living, for what you do out there, because you're at the front line as well. You're dealing with the COVID. And so thank you for doing that.
Thank you very much.
Very much. Thanks for sharing what you're seeing every single day. We're ready to go to questions.
Governor, first question today is from Max Philby at the Columbus Dispatch.
Hey, Governor.
Hey, Max.
As you prepare for the COVID-19 vaccine, I'm curious, are there any short-term or long-term funding needs from the federal government that you'd like to see fulfilled, whether it be with regards to tracking or anything else?
Well, we really need a bill. And, we need Democrats, Republicans to come together, Congress, put a bill together. I know a lot of people want to get it done in Congress. The president does. It just needs to happen. Everything from allowing us to roll money over so that we don't have to make decisions in December when we really need to move that money beyond December and into next year. Unemployment, there's many, many, many needs. I won't go through them all today, but we need to see a bill come out of Congress. And I'll talk about this, later in the week. But we need a bill. And, I'm still the optimist. I think there's a bill to be had, and I hope it can get done.
Next question is from Walter Smith Randolph at WKRC in Cincinnati.
Hello, Governor. This question is about COVID-19. Will you be willing to waive the accountability standards that go with state testing, like literary assessments? If yes, why? If not, why not?
I'm not sure I understand the question. I don't know whether Andy's still on there or not. Is Andy still on? It's probably not. Is he still on? Give me that question again.
The question was, will you be willing to waive the accountability standards that go with state testing, like literary assessments?
I don't know. We'll have to look at that. Yeah, I just don't know. We'll get back to you though. Thank you for the question.
Next question is from Farnoosh Amiri at the Associated Press.
Hi, Governor. Thank you for taking the time today. So pretty much every single health official that you've brought onto this call has mentioned in some way or another how this is the worst things have ever been in Ohio hospitals and throughout the state. And unlike other states like New York and California, who dealt with pretty severe first waves, Ohio is dealing with this for the first time, it seems like, as far as hospitalizations. And the main reason for that is how aggressive you were in the beginning, as far as dealing with precautions and setting up lockdowns. And so I'm wondering where we go from here as things are progressively getting worse. Many of the people on the call said they don't see an end to this until a vaccine, or possibly not even after that. So what for as far as any future plans for you in the next few weeks, as far as lockdowns or precautions, what are your plans to address this heightened wave?
Well, we know the lockdowns, can be very detrimental. We've seen that in area of mental health, for example. We see it in overdoses for drugs. I mean, there's all kinds of bad things that go along with a lockdown, and that's what has to be always weighed. As I said last week, it is a critical time, and it's a time when we need to pull back. There is some indication that Ohioans have pulled back some. They pull back at Thanksgiving. They pull back on the day after Thanksgiving. And we did not see as much movement as we've seen before. So I'm just asking every Ohioan, pull back more. If you didn't believe that, I mean, just listen to the nurses, listen to the people who are at the front line. There's a cause and effect here to what we do. We have the ability to pull this thing back, to slow this down, to plateau. The scariest thing is when I talk to the health professionals, as Dr. Thomas said, there's no indication we plateaued out yet. No indication at all. And even if we plateaued out at this level, it's still an exceedingly high level. So we've got to actually see these cases start coming down. And there's a lag. There's a 2 to 3 week lag before a case, someone is identified with a case, they test positive, and when they might be going into the hospital, when they might be going into the ICU. So we know that what's going to happen for the next couple of weeks is sort of baked in already. It's going to happen. But even more, that should be even more incentive for all of us to really kind of pull back, stay at home, go out when you need to go out, limit your activities. Every county in this state is at 3 times high incidence level. So we've not seen anything like this in the state. Haven't seen anything like this for 100 years. So that's really what needs to happen. We need to pull back. And as I said, there's some indication that that has started and that people are pulling back. We just need to continue to do that and to do it even more.
Next question is from Danny Eldridge at Hannah News Service.
Hello, Governor. So Representative Becker and a few other House Republicans have introduced articles of impeachment against you. Can you just comment on?
Yeah. I'd like for them to watch what we just watched. I'd like for them to go in and talk to some nurses who are frontline nurses who are dealing with people who are dying. I'd like for them to go talk to some family members, maybe a family that didn't believe that this could happen. Now at Christmas, there'll be one less person at their table or more. So at some point, this foolishness has got to stop. And we've just got to get, and I'm not talking about most Ohio. There's just a small number of people who just continue for whatever reason to think that this is and act as if this is some big joke and that this is all some fantasy. And I don't know how you watch these nurses or talk to them and hear them without understanding that. The vast majority of Ohioans do. There's a small number of people out there who are making a lot of noise. And I just wish that they would go spend some time talking to somebody who suffered through this, someone who sees the suffering every day.
Next question is from Laura Hancock at cleveland.com.
Hi, Governor. I have
Laura.
2 questions. My first question goes back to this verification of antigen positive cases. You've said that people are making extra calls. So what is being asked on these calls? Is there another round of testing? Can you explain what confirmation is? And then my second question is, does anyone know, I know Dr. Thomas is no longer on the call, but does anybody know more about the hospital that ordered the refrigerated truck, like where it's located, what its name is, anything like that? Thank you.
Let me see if Andy's still on there. He's off now. Okay. So I can't tell you that. We'll see what we can find out. The verification, and I'll go through this later today, or not today, but later in the week or next week in more detail. But the verification that takes place it is a verification in regard to whether this person, for example, had symptoms. So it is a personal contact that initially was felt was the proper way to do this. When early on, antigen tests were not being used as much, and we didn't have the experience with these tests, there was this added layer of verification besides the positive test. CDC has now said, or said some time ago, that no longer do you have to do that. So we will be at some point in the very near future shifting over from that protocol that we had kept with out of caution, even though the CDC had moved on. We will now be adopting next few days the CDC's guidelines, which is that these cases go in there automatically. And again, that's consistent with what most states are doing. It's consistent with what the CDC is doing.
Really quick, being that you had a false positive test from an antigen test, do you feel comfortable with the CDC's new guidance?
Yeah, I do, but I'm not the expert, and we'll get someone on here next time to give you more details about why the CDC did this and why the CDC and why our medical people feel confident about that. But they do, and again, it's the majority of states are doing that, and the CDC did this a number of weeks ago. But we'll give you more. We'll give you more when we got a medical expert on here.
Next question is from John London at WLWT in Cincinnati.
Hey, John.
Hi, Governor. I had some questions scribbled down here, but after listening to Stacy Morris, the nurse up at the Cleveland Clinic, where she said we need the help of the people to fight this. So I've been thinking about that since you started taking questions. You say pull back more. You got the holidays coming up. People are making travel plans. So I guess the question to you quite simply is, what must we do in December?
Yeah. Well, everybody probably could make their own list of what we all need to do. Look, number one, don't travel. It certainly increases the risk. You go to if you fly, you go to an airport. It's not being in the plane. That may be part of it, part of the risk, but there's a risk. You're coming in contact with a lot of different people when you're in that airport. A lot of people coming together. It just seems to me, I think most medical experts would say that is a very high risk proposition. I think so. That's number one. That's the easiest one. Easiest one to say. It's not easy to do in the sense if you're pulling back, you haven't seen your grandchild for 6 months or something. I'm not minimizing that at all. Very, very difficult, but that's certainly one. I think, just pulling back on what you do every day, and I talked about this a couple of weeks ago, but if everybody could take down by 20% or 25% just the contacts that they have. I mean, we're seeing in retail, and there's some good news. We're seeing people wear masks. Our team was out last week. They're out again this week. I don't have the report this week, of course, but last week they were saying 91 to 92% of the people in retail establishments, on an average, throughout Ohio, were wearing masks. That's very good, and it's much higher than we had it before. So if people are wearing masks, the additional thing is just to lower the contacts. Make the grocery list and go once a week, instead of 2 or 3 times that you might run out and pick up something. Just reduce those contacts. I think further, we're seeing kids that in school that are wearing masks every day. Congratulations to all our young people who are doing that. We're seeing the teachers do that. But then sometimes, we're seeing that guard come down. Parents, allow a sleepover at their house, something like that. So look, there's, I guess I prefer to look at it as, how do you do things positively for the next few months? Look at all the things we can do to stay in contact with our loved ones. Which what Fran and I did over Thanksgiving. We dropped off meals at two of our daughter's house. Fran mailed pies to 2 of our sons, and we had other ones come in and pick up food. And we were outside. We had masks on. Snow outside today. Wouldn't be great today, but you just try to do those things, and you have more contact with letters. You have more contact with FaceTime, and look, the good news is, for the first time, we know when this help is coming. I mean, we think that this is coming December 15th. Now, it may be off a day, something may happen, but the best information we can have is we're going to get the first batch somewhere around the middle of December. We hope the second company is going to come in about a week after that, and we're moving. Now, it's going to take a while to get us any kind of immunity. We know that. But within the first month, we're going to cover a lot of our most vulnerable people. And, you know, take that second month until they get the second shot. So they're not really totally, you know, covered. They're not covered really until you get the second shot. But, you know, help is on the way. So we just we got to get across this bridge. And I just think, you know, instead of me listing all the things people shouldn't do, I just think it's more of let's be creative and figure out the things we can do that are safe, and things that enable us to stay in touch with our loved ones, enable us to do what, you know, things that we should be doing. I think that really is really the key.
Next question is from Haley Nelson at WSYX in Columbus.
Governor, thank you for your time. I know you mentioned you would talk a little bit more about the vaccine and the rollout here in Ohio a little later on in the week, but I was thinking a lot about the vaccine and kids here in Ohio. I don't know if there's any information you could share with us about work being done there, how this might roll out with children, any special efforts going on there, because I know certainly the science can be different when we're talking about vaccines and children, and just how important it is to keep kids healthy and safe. Thank you.
Yeah, I mean, I think the most important thing, you know, for kids is to make sure they're up to speed on all their shots, which includes flu. I mean, those are things that can happen today. You know, any parent out there watching this, you know, can make sure that that child is up to date completely. I would not be fearful of going into a doctor's office. I would not be fearful of going into wherever you get these shots, whether it's your pharmacy or wherever it is. I think that's something that people can do today. Now, I'm not the medical expert. My understanding is that these have not been tested yet for children, and you know that will be coming. So my understanding is that you know children are not the most vulnerable, and they're generally not frontline health workers. So we'll start with the most vulnerable, and the frontline health workers is where we think that this you know we will actually end up starting. You know, children, certainly we hope at some point they're going to we should get vaccinated. But I don't have that information at, you know, at what point we might see that.
Next question is from Alex Ebert at Bloomberg.
Good afternoon, Governor.
Alex.
38 states told the Government Accountability Office that they were concerned about having enough supplies to distribute and administer the vaccines, according to a report that came out of the Government Accountability Office today. Where is Ohio in that level of concern? Are we going to lack some supplies that we need to administer the vaccines? And what did Vice President Pence tell you today on the call about what the federal government is going to do to assuage some of those concerns? Thanks.
Well, you know, the Vice President was very optimistic, very happy that this is coming, as he should be. You know, every doctor, Dr. Fauci and others who were on the call were all very optimistic. So